So Brain Center stands for Building Resilience Across Ages through Integrative Neuroscience. So the Brain Center essentially functions as a clinical and research entity at the University of Memphis, providing evidence-based and neuroscience-informed clinical interventions, and then we research the interventions and we forward mental health interventions in the pediatric mental health space. So it started back in 2017. I received state funding along with colleagues at the University of Memphis from many different disciplines. And essentially what we did was we created an entity, an interdisciplinary entity called the Brain Center. At that time, we didn't have a name for it yet. All with the idea of how can we treat and work with pediatric patients that experience mental health disorders. So it was about advancing the understanding of mental health and pediatric mental health and the current state of pediatric mental health. And it was also about how can we do research and create studies that show the current need for mental health interventions, and how can we use interventions to treat disorders that are very complicated, and how can we forward the mission and the goal of essentially providing evidence-based care and then having awareness. So there's a public element, or public health element, I should say, to kind of creating awareness for advocacy efforts and for mental health reimbursements, and just kind of calling into awareness, mental health issues are as debilitating as physical issues, and kind of having that forward thinking of parity, where there's equal focus and attention on both physical health needs and also mental health needs.